Good day, I am Micah and you're watching Health Watch 24/7. Today we shine the spotlight on a hidden epidemic, domestic violence among healthcare workers. Often viewed as the hero in scrubs, these professionals are also vulnerable to pain and abuse, not just in the workplace, but sometimes at home. In this special report, we'll explore what domestic violence looks like, how it affects the healthcare workers, and what we can do to help. Here with us to explain the definition of domestic abuse is Joyce. Joyce, what is domestic abuse?
Domestic violence, also known as intimate partner violence, is a pattern of abusive behaviors used by one partner to control the other. This include physical violence, emotional manipulation, sexual abuse, financial control, and psychological intimidation. It doesn't discriminate by profession, gender, or income level. According to the World Health Organization, about 1 in 3 women globally experience physical or sexual violence in their lifetime. In healthcare settings, one study published in the Journal of Interpersonal Violence in 2020 revealed that nearly 40% of female nurses and 12% of male nurses reported experiencing intimate partner violence. Among those who did experience it, over half reported an increase in workplace stress, absences, and difficulty concentrating. According to experts, healthcare workers already face high pressure environments. Hence, added trauma of domestic abuse can severely impact their mental health and their professional performance.
Because healthcare professionals are trained to hide stress and push through pain, spotting signs of abuse can be difficult, but not impossible.
That's right, Micah. According to HR at St. Aurelia's Medical Center, we started to notice repeated late arrivals, unexpected bruises, sudden withdrawals from coworkers, all of which hinted to possible abuse in their respective homes. The following are also signs experienced by our healthcare workers: frequent absences or last minute shift cancellations, visible injuries with vague explanations, isolation from peers, sudden drop in performance, excessive calls or visits from a controlling partner, and signs of anxiety, depression, or substance abuse. There are different types of abuse. There's physical abuse, which consists of hitting, pushing, or any bodily harm. Emotional abuse, which would be name calling, gaslighting, or humiliation. Sexual abuse, forced intimacy, or even reproductive coercion. Psychological abuse, which are threats, stalking, or intimidation. Financial abuse would be prevention of a partner from working or accessing funds. And lastly, technological abuse, which is monitoring phones, or social media control, or even digital threats. According to experts, abuse thrives in silence. Many healthcare workers stay quiet due to fear of stigma or professional repercussions.
But why does this happen, and what are the consequences?
Domestic violence is often rooted in power, control, and trauma. Healthcare workers who are often empathetic, overworked, and resilient may become targets for controlling behavior. The stress of the job may even prevent them from recognizing this abuse early. Consequences include increased risk of anxiety, post traumatic stress disorder or PTSD, depression, substance use as a coping mechanism, sleep disturbances, chronic fatigue, reduced job satisfaction and burnout, as well as negative impact on patient care and team safety.
So, how do we respond? What can institutions or maybe individuals do to help?
Create trauma-informed workplaces with safe reporting channels. Train staff and managers to recognize warning signs. Provide access to employee assistance programs. Allow flexible scheduling for survivors attending court or counseling. Ensure confidentiality and non-retaliation clauses in policies. Gentle reminder for coworkers and friends. Don't judge. Listen and support without pushing. Avoid telling them what to do. Instead, offer resources. Gently encourage them to seek professional help. Even a simple, "Are you okay?" can open the door to a life saving conversation.
So, if you know someone who is experiencing abuse, you may contact the number shown on the screen for help. Our healthcare workers care for us in our most vulnerable moments. It is time we do the same for them. Remember, abuse doesn't always leave a bruise, but it always leaves a scar. This is Micah reporting for Health Watch 24/7. Good morning.